Welcome to the 6th Annual ALS Fiesta presented by ALS Pharmaceuticals. It's great that you're joining us tonight. My name is Steve Beckvar. I'm the Executive Director for the ALS Association Greater San Diego Chapter. Tonight's program will focus on research and drug development, and you'll hear about some of the world-class ALS research taking place right here in San Diego. You'll hear from Tyler, Steve, and Paul, three incredible people touched by ALS. You'll also hear from a panel of experts from the ALS Association, specializing in the field of research during the live Q&A session at the end of tonight's program. Thank you again for joining us and helping us reach our goal of $100,000 tonight, which is an amazing Fiesta goal that we're trying to reach. Joining me live in studio is Dr. Eugene Brandon. He has spent approximately 30 years in scientific research and development and has been a loyal and dedicated board member for the Greater San Diego Chapter for more than 15 years, serving in each of the executive committee positions, including serving as chair. Dr. Brandon has helped lead the chapter's strategic planning, has been a participant and fundraiser for every San Diego walk to defeat ALS. He is also involved as a member of the ALS Association National Board of Trustees and currently is chair of the research committee. Eugene.
Thank you, Steve, for the kind introduction. In my 15 years with the association, what has been most impressive has been seeing the many volunteers and staff from all across the country, all across all walks of life, working together to advance the three pillars of the association's mission: ALS advocacy, care for ALS patients, and as we are celebrating today, research to better understand and treat ALS. What is most amazing in 2021 is the way we are able to use technology in so many ways for ALS. Whether it be virtual trials, including wearable devices and telemedicine, analysis of massive databases of clinical and genetic data with artificial intelligence algorithms, or brain-computer interface, which can turn thoughts into writing. We are now in a time when discoveries and knowledge are growing exponentially. While we can't entirely predict when the next breakthroughs will be, when we'll have treatments or a cure for ALS, it is clear that we are always a step closer to these dreams. We have learned an amazing amount in just the last few years through research on ALS. Now, with a special message for our San Diego ALS Fiesta is our bold and fearless leader, the President and CEO of the ALS Association, Kalanit Balas.
Hello, San Diego. So good to see you again. I think we're getting used to some of these video ways of the Fiesta, but boy, I still can't wait until we are in person having some Fiesta fun that brings so much energy and so much impact. And I just wanted to take a minute to say thank you. Thank you for everything that you've done, especially over this last year, to make sure that our community continues to be served and our mission continues to drive forward. Even in challenging times like we all have been facing, I'm so impressed with Steve and the entire team on their creativity and how they've really been resourceful to see the community fully served by the ALS Association. And that includes a lot of the work that we do to support research, and that research is still underway today in labs working all across the globe. You may or may not know that we have 171 projects that are currently underway across the entire research community, and that's really exciting. So today we are going to give you a little challenge and ask that maybe you donate $171 representing each one of those projects that are happening right now. There is more focus on ALS research than ever before, and that is super exciting. There are more scientists, there are more collaborators, there are more drugs in the pipeline, and there are more clinical trials. And I see it when I talk with researchers and I talk with different labs. The urgency is palpable, but so is the hope. And that is where we're at right now. But we're not going to sit back. We're going to push harder, right? We're going to ensure better, faster access to more treatments for people with ALS. I'm going to help people live longer, stronger lives, and engage them in the world on their terms, what they want. And one day, not only having a cure, but a way to prevent ALS. Can you imagine that? I can, and I'm really excited about it. So I hope you'll keep fighting with us, San Diego. We will do this together. Thank you for all that you do. Thank you for the bottom of my heart. Enjoy this fiesta, and I hope one day soon we can do this again together in person. Take care.
Cal&8, we appreciate your support, your bold leadership, and yes, next year we will be back together in person. We are one team, thinking big, and together in this effort to make ALS a livable disease. You can count on San Diego to do its part. World-class, transformative medicines and research are taking place right here in America's finest city, where Carlsbad-based Ionis Pharmaceuticals is working tirelessly to see the day where a therapy for ALS is developed. We are honored to have their CEO, Dr. Brett Monia, with us tonight.
So Ionis was founded in 1989 with a single mission. That was to invent a brand new drug platform for the discovery of new medicines for patients who really have no hope because there are no treatment options available. And a great example of that is a neurodegenerative disease called spinal muscular atrophy, a devastating disease, a lethal disease that had no treatment options prior to Ionis. We discovered, invented, and brought to patients Spinraza, which is now the foundation of care for all patients with SMA. What excites me the most is the drugs that are emerging from our pipeline for ALS. We now have 4 drugs targeting ALS, 4 independent causes of ALS, whether genetic or non-genetic, with 2 of them in phase 3 development. That is the latest stage of development before potentially reaching patients. Our FUS program is particularly exciting. This is a genetic cause of ALS due to mutations in a gene called FUS that is very rapidly progressing. And we are now in phase 3 development for our FUS program, as we are for another genetic cause of ALS due to mutations in a gene called SOD1. That's our drug for tofersen. So 2 late-stage drugs, 2 independent causes of ALS, and just like what we had done and accomplished for SMA, our mission and our goal is to do the same for ALS. All forms of ALS, no matter the cause, whether a genetic cause of ALS or a non-genetic cause of ALS, our goal is to bring medicines just like Spinraza to patients with ALS. And I am quite confident we're going to be successful. The patient has always been and will always be the center of our focus, our mission, and it's the patient that helps us through and gets us through the tough times because we know how much patients depend on us, just like patients with ALS and spinal muscular atrophy and other devastating diseases. It is what motivates us, it is what drives us, and it is what makes us successful. Patients are the reason for everything we do.
Thank you, Dr. Monia. Yes, patients are the reason for everything that they do and we do, and it's my pleasure to introduce Vice President of Patient-Centered Drug Development at Ionis, Christina Boyer. In addition to their world-class research, they have aligned with the Greater San Diego chapter with numerous community-based programs and activities, including volunteerism and outreach for the ALS community.
Hello, I'm Christina Boyer, Vice President of Patient-Centered Drug Development. I want to share the importance of community and how by partnering with organizations like the Greater San Diego ALS chapter, we are making meaningful contributions in patient lives. Ensuring the patient voice is represented within our decision-making process is central to our ability to bring life-changing therapies to patients. We strive to help patients beyond just the drugs that we are developing. We look beyond the disease to see the person, to understand what it means to live with that burden so that we can focus efforts and innovation on improving the lives of the patients we serve. So how do we balance it all? ALS is a great example of why we need to think big. It epitomizes the struggle found in rare disease. And by thinking big, we can put together the many parts of the patient care puzzle. For ALS, like most other rare diseases, there is still a desperate need to better understand the underlying biological mechanisms involved. This disease is puzzling, the diagnosis is challenging, and ALS is complicated because for a majority of patients, the underlying cause of their ALS is unknown. One of our first puzzle pieces and where we are making a difference is in tackling the genetic forms of ALS, SOD1, C9orf, and FUS. Today, these new potential treatments for genetic forms of ALS are currently being evaluated in the clinic. And while these drugs only serve a small percentage of ALS patients now, ultimately they will provide the data to advance research. And with time and commitment and collaboration, research will continue to progress. More and more connections will be made, and so will our understanding of the disease-causing mechanisms that will broaden our ability to combat ALS. Advocacy is another piece of the ALS puzzle. Advocating is about using your power and influence to make a difference in people's lives and improve their well-being. Advocacy is about relationships, trust, and collaboration. It's about helping all ALS patients. And that last piece of the puzzle, that piece belongs to the Greater San Diego ALS chapter. Their commitment to care and their mission says it all, to discover treatments and a cure for ALS, to serve and advocate for and empower people affected by ALS to live their fullest lives. I want to thank them for spreading the word, for raising awareness, and for banding together to make our voices louder and heard. The commitment they provide is critical to helping patients to get the support they need. We're not just here to save one person or one family. We're here to change the future of medicine, and that's differentiated by our purpose, our culture, our people, and our desire to make the future better for patients and their communities. Our purpose is to think big, put the pieces together, and solve the ALS puzzle. Thank you.
Thank you, Christina. Ionis is thinking big. They are thinking big with last year's launch of a patient-based program profoundly serving our ALS community in concert with the ADAPT Functional Movement Center. ADAPT is an integrative rehabilitation and recovery facility providing a personalized and comprehensive approach for overcoming the challenges of disability. ADAPT is a place of hope and support for our ALS patients and is led by John Monteith, the founder and executive director. Joining John in this segment is Tyler Decker, who was diagnosed with ALS at the age of 26.
I'm John Monteith. I'm the founder and executive director at the ADAPT Functional Movement Center in Carlsbad. We're a not-for-profit neurological rehabilitation and recovery center dedicated to improving the quality of life for anybody that's been diagnosed with a chronic neurological condition. Over the last 12 months, a big program focus for us has been serving the ALS community, which was made possible thanks to Ionis and the ALS Association working collaboratively with us to create the Hope Scholarship, which is a grant-based program for anybody who's been diagnosed with ALS to come through ADAPT and participate in our programs. The Hope Scholarship in 2020, despite the pandemic, we were able to put 6 PALs through the program and contributed over $26,000 in grant funding to those individuals who wanted to participate in the program. And I'm happy to say that there are still several of those original individuals continuing their programs with us at ADAPT in 2021. Fortunately, going into the new year, we were able to get another round of funding from Ionis and are able to put more PALs through the program and continue to build and grow it, which is really exciting. And it's a pleasure and an honor for us to be able to serve and service the ALS community without having to leverage their financial resources whatsoever. So I'd like to introduce Tyler Decker. He's one of our Hope Scholarship recipients. He's an inspirational young man, and he's been going to ADAPT now for close to a year and participating in our programs, and he's just got a great story, and he's an inspirational individual, and there's so much motivation and positivity that comes from him and his work that he's done with us. So I'll pass it over to Tyler.
My name's Tyler. I'm 27 years old, and I was diagnosed with ALS June or July of 2020. IONIS, through their Hope Scholarship, have helped me immensely. I'm able to come to adapt and work on recovery and staying focused and fit and healthy, and I feel safe here, so it's kind of become a safe zone for me. Finding a cure for this disease is important to me and everyone else who knows someone or is living with it, and unfortunately time is of the essence for us that have it, so coming here gives us hope that, you know, you guys are working hard to cure us.
Thank you, Tyler, for inspiring our chapter and everyone you meet. Tyler is one of the youngest, if not the youngest, ALS patient in the country. Tyler, we do want to develop that cure, and with all urgency, we will do all we can to get us there. And now I would like to introduce Becky Crean from IONIS, who will tell us about the ways we are improving ALS clinical research.
Hello, I'm Becky Crean, Executive Director in Clinical Development at IONIS Pharmaceuticals, and I'm really thrilled to speak with you today about the incredibly innovative clinical ALS research that's being developed in the field. Our scientific community's steadfast determination to find a treatment for ALS is truly infectious, and you can't help but want to be deeply involved in that pursuit. And so what's so inspiring is that the ALS community has this rare connection and an ability to collaborate with experts from completely different fields like engineering, artificial intelligence, which can provide valuable new perspectives on the brain, the illness, and eventually potential treatment options. So one innovative ALS clinical model that's come out of these collaborations are what's called adaptive trials. These trials are not only creative, but they're efficient, they're faster, they reduce the burden on patients because they can pivot in the middle of a study based on emerging data, which gets us closer and closer to an effective treatment. And as scientists, this type of innovation is something we really want to be a part of. We're really breaking new scientific ground and learning so much more about the cause of ALS. And one area is in genetics, which is rapidly discovering new genetic causes of ALS, like FUS, that are also treatable. So FUS ALS, like all types of ALS, is a devastating disease. But unlike most ALS patients, the FUS ALS patients are typically impacted by the disease much earlier in life, and it's much more aggressive. It's the leading cause of pediatric and juvenile onset ALS. But since the discovery of the FUS gene, there's been a tremendous amount of research on the disease. It's helped us really target a potential therapeutic, and within record time, through the collaboration with the entire community, we're now in the clinical testing phase of the drug. And so while medical advances in areas like gene therapy show potential to change the course of other potentially fatal diseases, a disease-modifying treatment in ALS has been difficult. However, the entire community of patients, families, researchers, drug developers, they haven't given up. And even though there have been setbacks, the entire community remains undeterred. A great example of that is the Ice Bucket Challenge. And so what started out as a real grassroots effort in 2014 with just friends and family just trying to help to bring attention to this devastating disease, it went viral and became so infectious that no one really could say no across the globe. And so everyone was getting involved in this Ice Bucket Challenge, and the community was so ferocious, they raised more private funding for a cause than has ever been done before. Plus, in addition to funding, the challenge raised awareness and brought new people into the field of ALS research. There are now thousands of people in the field where there was once only just a couple of hundred. So that example of community, innovation, collaboration between different groups is really paving the way for ALS treatment and research. And the landscape today looks much different than it did even just a few years ago. And so while there's still a lot of work to be done before a treatment is found, new therapies are being rapidly developed and propelling us forward as researchers gain a better understanding of this illness. So there's a lot to be excited about. And I'd like to thank the Greater San Diego ALS chapter for their continued support of the ALS community, and it's their dedication and determination to meet these significant challenges faced by families and caregivers that really fuel and inspire the work that we do. So thank you for all that you do.
Thank you, Becky, for that informative piece. Now, over to Melissa McElvain from our Greater San Diego chapter staff to tell us about a special opportunity.
If you're joining us for tonight's Fiesta celebration, then you most likely have a connection to our Greater San Diego chapter, and you stand behind us in supporting our mission to defeat ALS. Thank you for being a warrior alongside us in the fight against ALS. As our scientists have said, we've come a long way in making strides towards a cure, but the honest truth is, we're not there yet. That being said, I'm excited to announce that we have an incredible opportunity ahead of us. We have a wonderful family known as Friends of Leslie. To give you a little background, Leslie was an amazing woman who unfortunately lost her life to ALS. This anonymous donor and Friends of Leslie have generously agreed to match donations up to $20,000 to fund the mission. That's right, every donation will be matched up to $20,000 through the end of May. May is ALS Awareness Month. May is our Fiesta celebration. And May is an opportunity to double down in the fight against ALS. Can you imagine your $50 gift can turn into a $100 impact? Your $500 donation becomes $1,000. And your $5,000 contribution can become $10,000. The size of your gift doesn't matter, but your participation does matter. I promise you, your donation will make a positive impact on a person living with ALS. Please go to alsfiesta.com and make a donation to help defeat this devastating disease. We need you now more than ever. All donations through May 31st, no matter the size, will be matched and make double the impact. So please take action and fund our mission to defeat ALS.
Wow, thank you, Melissa. And now for a live thermometer update. So far tonight, we've raised $76,745.
787.
There you go. Let's keep it rocking and rolling. We're live. Let's keep that thing moving along. It's now my pleasure to introduce Steve Bloom, who is living with ALS. Steve is incredibly grateful for the support of the ALS Association, and not only for himself, but for families all over San Diego who benefit from the Greater San Diego chapter services. As a result, the Bloom family created an endowment fund in his name to support the Greater San Diego chapter and ALS Association in the areas of research and care services. Establishing this fund will help ensure that ALS patients in the future can continue to benefit from the research and support the association provides.
Hi, I'm Steve Bloom. I was diagnosed with ALS in January of 2020, right before the pandemic shut us down. I'd like to speak about the clinical trials that I have attended in San Diego under the auspices of Dr. Ravitz. The reason I got involved in these trials is because when I was diagnosed with ALS, I was also informed that I could not really do anything proactively to help stay the progress of this disease. And all prior problems physically I've had, I've been able to go on a workout regimen or physical therapy to get better. Unfortunately, I don't have that option. However, I was interested in helping the fight by going into the clinical trials. And of course, this became something much more important to me than just beating the disease, because I was able to meet this team of caregivers throughout 6 to 8 week sessions, and they were just amazing people. And if you think about during the pandemic and quarantine, this became my social bubble. And the nurses, the doctors, the clinicians were all just wonderful people. They greeted me back through sessions. I had follow-up calls, and the procedures were done in the most caring and painless methods that were involved. And Dr. Ravitz came in and spoke to me about how incredibly excited he was about this particular program. And here's a doctor who's at the cutting edge of research, and he's excited about this, so I have to be excited about it as well.
Hello, I'm John Ravitz. I'm a neurologist at University of California, San Diego. I'm head of the ALS programs at UCSD, and I've been here for 10 years. And my background is in clinical neurology and clinical neurophysiology and neuromuscular diseases. So my current time is divided into three different areas. One is clinical care. The second is what we call translational research, which is drug development and developing therapies. And the third is really trying to understand the fundamental aspects of ALS. So the exciting thing that's going on now is the gene therapy trials, because, and I'd like to just explain a little bit about why everybody's so excited about that. But before I begin, I just want to say that most of ALS is not genetic. It's what we call sporadic. So it hits out of the blue, and we don't understand what the environmental stressors and triggers there are, but most of the time it's sporadic, and the families don't need to worry. But about 10%, probably even more, 15% of the cases are inherited by a genetic mutation. So that's a small piece of the pie, but the important part of that small piece of the pie is that we know what the mutation is, we know what's doing it, and so if we can understand it, and if we can target it, and if we can undermine it, then we have a chance at the bigger, more complicated part of the problem, which is sporadic ALS. I guess what I personally see is that everybody's got to participate and help out, and if it's not just for the here and the now, it's going to be for the next generation of patients, so that we'll be so much better and smarter in the future. So it takes all hands on deck, everybody to participate, scientists, doctors, regulatory institutions, patients, families, everybody's got to participate in this. In San Diego, I've seen this just blossom with the strength of the medical center and the strength of the ALS Association and the crosstalk between us and the support. It's really been a critical part of our caring for patients, is having the ALS Association partnership.
Thank you so much, John, for explaining the excitement around gene therapies and the other aspects of the clinical work going on in San Diego for ALS. Now, with another fantastic story of ALS drug development happening in real time right here in San Diego, here's the Chief Scientific Officer of Ionis, our friend Dr. Frank Bennett.
So Ionis has been working on ALS for over 18 years now. We started with a collaboration with a group of San Diego scientists at UCSD and the Center for Neurological Studies. That is Dr. Don Cleveland and Richard Smith, respectively. And originally we thought we would focus our technology on finding a drug to treat an inherited form of ALS due to patients that have a toxic gain of function variant in a protein called SOD1. And that research program really was the genesis for our neurological disease research programs. The first drug that we started working on is currently in phase 3 trials. It's a drug called tofersen, which is being developed by our partner Biogen in Cambridge, Massachusetts. That trial should finish by the end of this year, and if it's successful, it will be the first example of a genetic-based therapy that treats the genetic cause of ALS. It's in a subset of patients. It's a fairly rare form of ALS, but it's an important proof of concept to show that ALS is a treatable disease. While we were working on the SOD1 antisense drug, I had my first interaction with ALSA, and actually ALSA helped fund the initial set of studies that were being performed at UCSD, and without ALSA, I'm not sure we'd be here today. So the money that you raised to support research is making an impact on creating medicines for ALS patients. And I'm very grateful for all the support that ALSA has given both Ionis and the program that we're working on together. Yeah, so there's additional drugs that are in the pipeline. The next most advanced drug is a drug targeting a genetic form of ALS that's caused by mutations or expansions in a gene called C9orf72. And again, that was done in partnership with our colleagues at UCSD. Actually, the Ice Bucket money helped fund a lot of that research. That drug is currently in a phase 1/2 study, again, partnered with Biogen. And it's specifically for patients who have this mutation in the C9orf72 gene. We have a third drug that's also partnered with Biogen that's targeting a gene called ataxin-2. So recognizing that I have an ability to help patients have a better life is what truly motivates me and causes me to come to work every day.
Frank, I think we'd all agree the work at Ionis is nothing short of brilliant. And we are so fortunate to have you and Ionis right here in our neighborhood. And now we have a very special message from Paul Northheimer of San Diego, who has ALS in his family and feels strongly about participation in clinical trials and ALS advocacy.
Hello, my name is Paul Northheimer. I'm a San Diegan, and I'm also a research participant in a couple of clinical trials for ALS. I'm asymptomatic, meaning I don't currently have the disease, but I come from what is called a Falls family, or in more familiar terms, my family has a genetic link to ALS, or familial ALS. More specifically, we carry the SOD1 mutation in our family's lineage. In my immediate family, I've lost my father, my grandmother, and 2 of my uncles to ALS. In my pedigree, I've traced 14 members of my extended family that have lost their lives to ALS. Now imagine having that bit of information, that the horrific disease that you witnessed firsthand take your father's life was now potentially your fate as well. For me, I had 2 immediate reactions. The first was, as parent protector, not wanting the kids to know. After all, they were still relatively young. The second was that I would do anything and everything I possibly could do to devote myself to research and participate in whatever trials were available to me so that I could do my part to help lead to a possible treatment and cure. That you could use me as a guinea pig and poke and prod and stick me as much as you can, and they do, and they did, as long as we were working toward the same goal of figuring out how to beat this disease. Sure, participating in research studies or clinical trials is not for everyone, and for those willing to do so, you will get more out of your participation than you could ever give. I realized that the best way for me to contribute outside of participating in these research studies was to actually open up and dialogue about ALS, to become an advocate for our pals and cows, to shout it out from the mountaintops. I owed it to my father, my grandmother, my uncles, to help educate and inform as many people as possible about the disease and how it impacted my family and so many other families. Your support means so much to our pals and cows. Thank you for being a warrior in our fight against ALS.
Paul, Thank you for sharing your story, and without a doubt, it will inspire others who have thought about participating in research but have yet to take action. Your message will undoubtedly help kickstart someone to take the next step and change lives for the better. It's so inspiring, Paul.
Yes, Paul has had a profound impact on our chapter, staff, and our ALS community. For almost 20 years, he's put together a walk team with the Walk to Defeat ALS. Amazing. What's also amazing and inspiring is just yesterday, the ALS Association announced a very bold goal of making ALS a livable disease by 2030. Our organization will continue to pursue its vision of a world without ALS, but believes that the right focus and enough resources within a decade, people with ALS will be living longer lives with greater quality of life, and that some people at higher risk will be prevented from getting the disease. Here is a video just released yesterday from the ALS Association.
For decades, ALS has been a fatal disease, but now the ALS Association has set a goal to make ALS a livable disease. ALS as a livable disease means living longer lives. It means living a better quality of life. And it means preventing your loved ones from getting the disease. We will do whatever it takes to make life-extending treatments available to all people with ALS. We will focus on preventing the harms associated with ALS.
It also means doing whatever it takes to ensure all people with ALS are empowered. It's their life. They get to live the way that they want. And how do we eliminate and reduce that physical, emotional, and financial burden that every person living with ALS and their entire support system faces?
We will do whatever it takes to screen and identify those at risk of ALS to help prevent new cases.
We need to focus on finding new treatments and cures. This means more clinical trials, more participation in research, and more focused research.
We need to identify risk factors, treat ALS as soon as possible, and develop preventative treatments. We need to deliver state-of-the-art care and improve assistive technology. Our efforts to make ALS a livable disease brings us closer to a world without ALS. To get there, we're going to need everyone's help. We will do whatever it takes to make ALS a livable disease. So join us in fighting for people with ALS like me and our loved ones at als.org.
Wow. A livable disease by 2030. That's incredible. Now, I would like to introduce our panel that will field questions that have been submitted online. Here we have Neil Thacker, our Chief Mission Officer from the ALS Association. Kuldip Dave, our VP of Research. And Jill Yursak, VP of Mission. And we are ready to have an interactive session now, which is a Q&A to finish up the hour. Thank you everyone who stayed on this long. We really appreciate it. The first question I think we should ask Neil. So as Chief Mission Officer, you should be able to help us out with this. The ALS Association just publicized its strategic plan to make ALS a livable disease by 2030. Neil, what does livable disease mean?
Yeah, that's a great question, Eugene. And I guess let me just say a couple of things before we talk about that. First, I want to thank you all for inviting us. I wish I could be in San Diego in person, but I'm at home in Maryland right now. I wanted to let everyone know that this plan that you're seeing is a product of a lot of work from a lot of different people, including some leadership from your chapter. So Steve Beckvar was part of this planning committee and spent, I think, about a year working through a bunch of different ideas, different concepts, different strategies to get to this idea of making ALS livable. And I don't know if you all know this, but Eugene Brandon is chair of the ALS Research program. And he's been advising us on all the science, on the scientific decisions that we have to make, on the emphases that we should be making in our research spending. And of course, our research program is going to be a critical part of this transition to get ALS from where it is now, which is really not okay, into something that is more bearable. And so to your question, Eugene, making ALS livable is a subjective word in some ways, because what's livable, what's important to everyone is different for everyone. It's a way for us to recognize that we need to value what the person with ALS finds most as important and helps them do that. In a practical sense, it really means people being able to live longer. It means an improved quality of life, so people get to engage with the world in the way that they want. If that's as a parent, or they're really into music, or they're involved in their community, their church, or they just want to hang out with their family, that's all what we want. We want what the person with ALS wants. They get to set their own goals for life, and it's part of our job to make that happen. And it also means then that the complications and challenges that come with ALS, the physical harms, the financial burdens, the emotional stress, get reduced or avoided or prevented. And it also means that when someone has ALS in their family, the things that caused ALS for them doesn't also cause ALS for the people they love. It could be some familial genetic issue, but it may be some environmental exposure for people in their military unit. We don't quite know what causes ALS yet, and we need to not only figure out what causes ALS, but with the intention of being able to prevent ALS in other people. We're not trying to learn things, we're trying to do things. And so that's what this concept of livable is. It's a way of helping us focus on what's important, what's most immediate. And in doing so, we need to start changing how we're doing things at the association today. And we're starting to do that through that strategic plan that Steve helped pull together.
The next question we have is from Tony from Carlsbad. And Tony asks, how far are we from finding a solid cure for ALS? What are the obstacles preventing a cure for this disease? I think we'll give this one to Kuldip. Kuldip, do you want to field this question?
Yeah, thank you, Eugene and Steve, for inviting us to be on this panel. What's preventing a cure for this disease? ALS is a complex disease. There's something called clinical heterogeneity, which means that, one person with ALS may have symptoms that start in the face or the mouth area, and another person may have symptoms that start in the arms, and others may have them in the legs. If you've met one person with ALS, you've met that one person with ALS. No two people look alike, have the same symptoms. Layered on top of that is biological heterogeneity. And what do I mean by that? Heterogeneity is just another word for diversity. So biological heterogeneity means for some people, ALS may be driven by inflammation pathway. But for some other people, it may be driven by protein handling pathway. And for someone else, it could be the mitochondrial pathway. And a combination of many of those pathways. Layered on top of that is, as Neil just talked about, there are various different risk factors for ALS. So we know that age is the biggest risk factor, but there are others such as genetics, environment, and again, a combination of these factors that may drive pathology. We also know that we have signaling molecules in our cells, and those are often redundant, which means that if we go after one, something else might compensate. On top of all of this, there isn't one objective biomarker that would help us diagnose the disease or predict whether someone progresses faster or slower. By the way, these issues are not just for ALS, they're for all neurodegenerative diseases. There's no cure for Alzheimer's or Parkinson's or Huntington's. And because of all these reasons, our trials have to be large and expensive and time consuming. And this is why the field has started addressing this heterogeneity, this diversity. Just like you don't treat cancer as a whole, now we treat pancreatic cancer with some treatment. We treat bladder cancer with another treatment. Similarly, if we can boil down ALS to different pathways, for example, if we can identify that someone has mitochondrial ALS, then we treat them with mitochondrial drug. If someone has protein handling ALS, we treat them with autophagy drug. And this is where the field is now going. And we hope that these obstacles that are preventing us, we can mitigate them and overcome them.
Thank you, Kuldip. That was really very helpful, speaking to the heterogeneity and the different types of ALS that we're now starting to understand much better. This next question comes from Jesse in La Mesa. The question is, and I'll ask Neil this, is NurOwn, a cell therapy, going to become available to anyone that wants to try it? What can you tell us about NurOwn, Neil?
Yeah, that's a great question. NurOwn, as you mentioned, is a stem cell therapy. It's a particular form of stem cell therapy, and I don't know when it's going to become available to everyone because I haven't seen all the data. It hasn't all been published yet, and so we're in a really strange situation with this drug. And so I've seen, and I'm sure most of the folks on this meeting have seen, some very exciting videos on the internet of people talking about the benefits that they've seen from NurOwn, including restoration of functioning in some cases. Even if it was temporary, they were starting to get better, to feel better, which is super exciting. And then when the company released their preliminary results from their phase 3 trial, they didn't release any data that talked about that. The only benefit that they indicated from their data was showing that some people showed a decline in progression of disease. And the magnitude of that decline was only about 2 points on the FRS scale. So it was about the same range of benefit that we're seeing from the Amylyx drug. But the benefit was only in about 35% of people who were in the treatment group, and almost 30% of people in the placebo group also had that same decline in progress. And so the statistical analysis suggested that decline, that slowing of progression may only be happening because of chance. So when you look at those two stories, the videos, and then you look at the data that's been released so far, it's like they're talking about two different drugs. And then a few weeks ago, the FDA made a statement about NurOwn, which is even stranger, where they said that they were seeing excess deaths in the treatment group. And I had never seen or heard any information about excess deaths in the treatment group. So I don't know what's going on. And I've asked for more data. We know that the company has submitted a publication to a journal for independent review, which is a big step forward, but I don't know what's in that paper. I don't know what it's going to say. I don't know if it's going to validate and provide more evidence to document the things that we've been seeing on the internet. I don't know if it's going to give us more light into that 5% margin of people who might be getting better, the percentage of people on the treatment versus the percentage of people on the placebo group. I don't know if they're going to talk about the safety issues that the FDA were raising. So there's just a lot of unknowns. I don't know. I wish I did know more. I would like to know more about that.
Yeah, thanks, Neil. Obviously, it's so critical that we get the information, we get the data in order to really even have an opinion on this. So I guess the jury's still out on what's going to happen with that NurOwn cell therapy. The next question comes to us from Todd in Oceanside. And Jill, I think I'll ask Jill this question. This is, I want to thank you all for all being on the East Coast. You're staying up late with us here in San Diego and your California connection. So Jill, Todd asks, should I look into alpha lipoic acid as a possible nerve regeneration treatment, although it comes from diabetic therapy for diabetes? I guess the question, about alpha lipoic acid, but also other types of treatments that are not approved or, have been talked about in the community that could potentially be benefiting people. Jill?
Sure. So thanks for having me, Eugene and Steve. It's a pleasure to be with you tonight. We wish we were in San Diego. It's one of my favorite cities in the country. We're very jealous of your weather. And Todd, thank you for the question. I looked up alpha lipoic acid, and it is an antioxidant, so I can see how that could potentially be beneficial for people with ALS. But right now, I looked it up, and there's only some studies done in fly and cell models, so we don't know if that's going to help in humans right now. And so I would encourage you to ask your doctor if you want to engage in a treatment that is off-label, or sometimes they call an alternative treatment. And so one of the great resources that we have, and we've been funding for many, many years, is ALS Untangled. So it's alsuntangled.org. Dr. Rick Bedlack runs a site. And the whole point is to understand what some of these off-label treatments or alternative treatments can do for you, if they're safe or not, and are they effective. And so researchers who are experts and clinicians do reviews, and they give it a grade from either A to F. And so A is they recommend it's okay to take this. Please stop, again, talking to your doctor first. F, and with F, is a fail, and so you should stay away from that drug, definitely. So it's a really great resource. I highly recommend that you check that out, and it's a way really to combat a lot of people right now, unfortunately, are preying on people with ALS and their families and selling drugs or telling people that something that they're selling that's just really nothing, has an effect. And so we want to prevent that, and Dr. Bedlack and the association together have been really mindful of this, and it's a really great resource to check that out and to understand if whatever you're thinking about taking could be beneficial to you.
Yeah. Yeah, thank you, Jill. And I'll just say it again for those who are interested, alsuntangled.org. It's a consortium of doctors who look at various types of alternative therapies. I look at it, I find it very informative. They do a report on each one, and it's all done sort of democratically. So you vote for which ones you want to learn more about, and those that reach the top of the list are the ones that the doctors research and do a report on. So it's really a fantastic resource, alsuntangled.org. Okay, we're running short on time now, not surprising, so much to talk about here. But I think we'll take the last question and we'll bring Kuldip back into this. Kuldip, this is a question about drugs or therapies that could help with speech slurring. Are there any drugs or therapies available for ALS patients that can help with speech slurring?
So there aren't therapies right now that help with that have been approved with speech dysfunction in ALS. We are testing a drug in the clinic. It's called Nudexta for exactly that. It's doing both speech and swallowing deficits in ALS, and trying to see if Nudexta would be efficacious. What's important to know is that we, at the ALS Association, have supported this trial, this study, and that we're not just supporting disease-modifying therapies like the AMX 35 compound, but we're also supporting symptomatic therapies that go after individual symptoms like speech and swallowing issues and deficits. This is actually, Eugene, an opportunity for us to repurpose the therapies from other diseases, because speech issues are not just in ALS, they're also in Parkinson's, for example. And so if there are drugs that are developed for speech for those other diseases, we could potentially repurpose them for ALS. And so, very good question. Thank you. And as I said, we hope that beyond Nuedexta, there are other therapies that are tested for these types of symptoms.
Issues and clinical options.
Go ahead.
And I just want to remind everyone that you have world-class ALS care in San Diego through the clinic that Dr. Ravitz heads. And we support 175 clinical centers around the country, but certainly San Diego is among the leaders. And the work that your chapter does in connecting people to that clinic is a gateway into research, but also a gateway into multidisciplinary care, which we know extends life. And so to make ALS livable, we need to do more of that. We need to get more people to clinic. We need to build up those clinics, and we need to improve all of the things that come along with high quality care, fewer falls, fewer infections. All of those things really matter. And you guys have been great leaders in that.
Thank you, Neil. Unfortunately, we're approaching the top of the hour, and while we would love to talk with you for another hour, I know there's so many questions we weren't able to get to today. Maybe one time we'll be able to do another session like this and do a webinar or something. That would be fantastic. But really want to thank you, Neil, Jill, and Kuldip for taking the time and staying up late with us here in California to answer these questions. Thank you again.
Thank you.
Thank you for having us.
Thanks. So with that, we would like to send it back to Melissa for a special thank you message.
At this time, we'd like to thank our generous Fiesta sponsors. Our 6th annual ALS Fiesta is presented by Ionis Pharmaceuticals. We've heard from their amazing staff, and we are so appreciative of the progress they're making in the ALS research space. Thank you, Ionis. Our generous premier sponsors include Access Medical, Geico, and LifePro. Silver sponsors are the Merrill, Bradshaw & Cruz Group, Helix Smith, and National Seating and Mobility. Our bronze sponsors include Casa Companion Home Care Solutions, Tito's, At Home Medical, Maxim Healthcare Services, and Harmony Home Medical Supply. Last but not least are our supporting sponsors: Adapt Functional Movement Center, Kula, Cutwater Spirits, the San Diego Union Tribune, and Valley View Casino and Hotel. We are so grateful for all of our trusted partners and their support in the fight against ALS.
What an evening. Thank you, Melissa. We really do appreciate our sponsors. And of course, thank you to Eugene, Kuldip, Neil, and Jill. As a reminder, any donations made to the Greater San Diego chapter will be matched dollar for dollar up to $20,000 through the end of May. May is ALS Awareness Month, and what an amazing opportunity to have your donation doubled. Wow, we are almost to goal, and look at the Fiesta thermometer. We started tonight at 71,000, and we're currently at 82,550, striving for tonight's goal of $100,000. Please go to alsfiesta.com, make a donation, and know that your support will be doubled. Thank you, Friends of Leslie, for the generous match opportunity. And of course, to all the donors, sponsors, and supporters, and especially our ALS patients and families, we are one team and look forward to the pursuit and goal of making ALS a livable disease by 2030. Thank you so much for joining us for tonight's ALS Fiesta celebration.
Thank you.